Good afternoon. Today we are going to do a kidney dissection of a lamb. Before we start the dissection itself, I just want to bring your attention to some of the equipment that will be needed for the dissection. First, we have a pair of surgical scissors. This will be used to cut a layer of the capsule off. In order to grab our capsule, we are going to be using a pair of forceps. We have a wooden skewer. Ideally, we would like a metal needle pointer. Unfortunately, we do not have one today, so this will have to substitute in its place. This will be used for pointing the different parts of the kidney as we go through it. Probably our most important piece of equipment is the scalpel, which we'll be using to cut inside the kidney. And lastly, we have a dissection tray over here, which is used for to cut on. Unfortunately, we don't have a dissection tray, so we are just using a normal cutting board, and this will substitute in its place. Now, before we start, I just want to bring your attention to the kidney itself. You can see it looks like a bean. It's got a bean shape, and it's got all these bits of white around it. These bits of white are known as the adipose layer, and it is used for mechanical shock absorption for the animal itself. All right, let's get into the dissection itself. Alright, so first of all, I would just like to bring your attention to the capsule, which is a membrane surrounding the kidney. It is a little bit tough to grab at times, but if we can try and see it, it is that membrane over there. Alright, and what this capsule is used for is to protect the kidney from any kind of infection from bacteria or any other kind of pathogens that might be around. So I'm going to try and quickly just snip a little piece off, and we can have a look at that a little bit later. Right, so I have a little piece, and you can see it grows a lot smaller. That is the capsule when it's used for protection. Okay, let's cut inside the kidney itself. Okay, let's have a look inside the kidney. So if I can ask the camera person to come and have a look over here. Now, this is what the inside of the kidney looks like. If I can quickly just spread it out and make sure you can see. We can see that there are distinct layers of the kidney. This first layer over here, this is known as the cortex, and the cortex is the place where the nephrons start. And nephrons are very important for osmoregulation of the animal. If we move slightly towards the inner section of the kidney, we can see there's a change of color. And these change of colors, this change of color represents the medulla. And within this section, we can see there are various pyramids, which might be slightly difficult to see, but there are pyramids within there. And within these pyramids in the medulla are different concentrations of salt, which are very important for the osmoregulation of the animal. And this is where various collection ducts will reabsorb water and various ions and things like glucose. If we move towards the center of the kidney, this comes towards the pelvis section, and what the pelvis does is it acts as a funnel that collects the urine, and what it does is that funnel comes towards this little piece over here. That is known as the ureter, and the ureter transports the urine down to the bladder. This whole section over here is known as the hilum. Within the hilum, you will be able to find the ureter, but also blood vessels known as the renal artery and veins. Unfortunately, we cannot see the renal artery and veins in this kidney, but A way to differentiate between which is having a look at the width of the blood vessels themselves, as well as the size of the lumen. That would help us differentiate whether it was an artery or a vein. All right. And that is our kidney dissection done. Thank you very much for watching. I briefly want to talk about some safety considerations that need to be applied while doing this kidney dissection. The first is to always wear safety equipment such as surgical gloves and a lab coat. This will help prevent any kind of contamination, and it is for hygiene purposes. The second safety consideration is to always check your apparatus or equipment you'll be using. You want to make sure that you have a sharp and effective scalpel and make sure that there's no problems with the equipment you'll be using to prevent any kind of injury. While talking about safety equipment, it is important to consider the handling of the equipment itself. We want to make sure that we are handling it correctly and we know how to handle it to prevent any kind of injury. The fourth safety consideration to take into mind is to always work on a steady surface. If your surface is not steady, you might slip or something might move, and this could cause an injury. So please make sure you always work on a steady surface. The fifth safety precaution, and this is very important, always have a medical kit nearby. This is in case if something does go wrong, which we are trying to prevent, we can see to the matter swiftly, efficiently, and effectively. Thank you very much.